All right, guys, so here is the resource we're going to be using for this class. It's the Cleveland Clinic's A Patient's Guide to Total Joint Replacement and Complete Care. The information in here has been well established and tested for many years. Even though your doctor, your surgeon isn't a Cleveland Clinic surgeon, that's okay because the general guidelines are consistent across multiple procedures and multiple surgeons. So let's just start going through, and there is a hyperlink to this document in the video description below. So if you have any questions, if you want to download this for yourself, absolutely go ahead and do it. The introductions, we can generally skip this because this is just talking about the Cleveland Clinic, their complete care program. Let's start here. Let's talk a little bit about the knee itself. And then this way you kind of can speak the same language as the surgeon, so you know what the bones are, what the muscles, the tendons, the ligaments are. So the knee technically is a hinge joint. A hinge joint is something like a finger that flexes and extends. The thing to remember that nobody really discusses too much is there is also a rotational component to the knee joint. So in a normal knee that has not been replaced, when you think of your current knee right now, when your knee is fully extended, as it flexes, what happens is the tibia, the lower leg bone, actually rotates to unlock the knee, and then the knee bends. So the first 0 to about 15 degrees of flexion, there's a rotation component in addition to the hinge component. When you have the knee replacement, some implants will have that rotation component, some won't. It's just worth noting that the knee you put in for a knee replacement isn't necessarily exactly like a classic hinge joint, like the previous joint that was in there. So let's talk about the anatomy. You can see the bone at top, that is the femur, that's the thigh bone. The main bone below, if you feel your shin bone, that is the tibia. On the outside of your knee, there's another long skinny bone called the fibula. So there's actually 3 main bones of the leg, the femur on top, the tibia, which is the shin bone, the fibula, which is the bone that runs along the outside of the lower leg, and then of course the patella, the kneecap. And what the patella is it's a small round floating bone that sits inside the tendon that actually improves the mechanical advantage of the knee and improves leverage of the knee, and it protects the knee joint itself from any type of trauma that might come at you. Typically when we're looking at a total joint replacement, there's a couple different ways this is done, but what happens is they're replacing the bottom of the femur, they're replacing the top of the tibia, and in many cases, they're going to put a cap or a button on the bottom of the patella. So we've got 3 main surfaces that are being replaced with the implant. One thing that isn't discussed often enough is the fibula, this long skinny bone on the outside of the leg. It's not replaced. It's not changed in any way. You can see how it comes up under the rim of the tibia. But oftentimes, if there's arthritic changes in the knee joint between the tibia and the femur, the fibula probably has some arthritic changes as well. So don't be surprised if there are episodes of pain on the outside of the knee consistent with degenerative changes at the fibular head, but it was not affected or it was not changed during the knee replacement, but certainly could be contributing to some of the problems after the knee replacement. So understanding the anatomy is important. Then of course, from a ligament perspective, there is the lateral collateral ligaments on the outside, the medial collateral ligament on the inside. There's strings that run, leaders, ligaments that run on the outside of the knee that maintain stability side to side. And then within the center of a normal knee, a natural knee that has not been replaced, there's an ACL, PCL. Those are the 2 crisscross ligaments that keep the knee from separating front to back. Most operations remove those 2 ligaments, but there are some implants coming out these days that try to preserve some of those ligaments. So 4 ligaments, 4 bones, that is the structure of the knee joint. As we progress, we're going to skip the information on total hip because this class is dedicated to the total knee replacement. So let's talk about preparing for surgery. Exercise, right? Exercising up to the day of surgery helps to improve the strength, range of motion, and endurance. This helps lead to a successful outcome and recovery. Talk to your surgeon or physical therapist about a referral to physical therapy if you would like to develop an exercise program, in addition to see the exercises at the end of this guide. So from my perspective as a physical therapist who does work with individuals before their surgery, there's always some confusion. You know, how early do you want to start physical therapy? What kind of stuff do you want to do for physical therapy? I would say kind of the ideal window would be about 6 weeks prior to surgery. And the reason why is we need time for the body to adapt. We need time for the body to improve, the physiology to change, the muscles, tendons, ligaments to adapt to the exercises that we're doing. Certainly, most of us having a total knee replacement are adults, probably over the age of 40. Our bodies do not adapt as quickly as they did when we were 20 or a teenager. So starting a program 6 weeks before your knee replacement is a great opportunity. That also gives you time to talk to your physical therapist about things beyond exercise, like preparing your home for a safe return to your home after surgery, talking about support systems and finding and figuring out a way. You know, how do you handle that random question that pops up in the middle of the night at 3 a.m. when you're not sure if it's something that needs an emergency call or going to the ER, or if it's something that could be handled at home. These are things that you can address with your physical therapist as long as you have a big enough window before surgery so that you can go into surgery knowing everything is taken care of, everything is going to be ready to go. In this guide, we talk about, why is exercise so important to your recovery? Strengthening exercises for the hip or the knee joint improve recovery. I'm going to tell you, I focus primarily on hip and ankle exercises when somebody is scheduled for a total knee replacement. The reason why is we want to improve the strength, structure, function of the joint above and below the knee. And quite often, and you might be sitting here thinking this right now, well, Tony, how can I exercise if my knee hurts so badly just sitting here? Because there are absolutely lots of exercise opportunities that we have that do not aggravate the knee joint, but provide strengthening above and below, as well as considering the rest of the body. The knee is just one joint in a complex chain of joints and system of muscles and blood vessels and nerve endings. So even if you never did any exercise for the lower extremity that's going to have the operation, improving the health of the heart, the cardiovascular system, your respiratory system. Work on things that improve upper body, since you're going to be using a walker or crutches or cane. Improving the strength of the shoulders, the elbows, the wrist. Improving your ability to get up and down using the non-surgical leg. To negotiate obstacles while you're walking. To improve your balance. Even if we didn't do any kind of exercise to the knee, improving balance is going to improve your ability to return to walking, return to driving, return to the activities that you need to do when the time is ready. So there is no limit to the opportunities we have prior to surgery to improve your overall health and conditioning. So the challenges of a total knee replacement recovery can be faced with better opportunities. Let's see what else is in the guide. So circulation exercises, there's going to be swelling after your knee replacement. We want to improve the circulatory system the best we can, the cardiovascular system the best we can. It's normal to have circulation concerns after surgery. Circulation exercise can help improve and prevent swelling and serious complications like blood clots. I mean, certainly this is one of those risk factors that we need to be able to manage. And the better we manage and prepare before surgery, the better your outcome is going to be. So diet and nutrition. Now, I'm the first one to say, nobody knows what the perfect human diet is. I've studied and researched diet recommendations for almost 20 years now. And I can tell you that I've seen people respond to diets that other people just didn't respond well to. There is no consistent answer in the research. But generally speaking, right? Drink plenty of fluids and stay hydrated. That's going to be universal. Whether somebody wants to go on this diet or that, we need to stay hydrated. Eating more fiber to avoid constipation, often because the medication, the pain meds and other medication will tend to slow down the digestive tract and lead to constipation. So foods that contain more fiber. Certainly we can look at different kinds of fruits and vegetables. There's supplement opportunities out there as well. Eating foods that are rich in iron, such as lean meats, dark leafy greens, raisins, prunes. Some patients may require blood transfusions, iron infusions. It's questionable based on the existing research whether we're able to absorb enough iron from food alone to really handle the procedure that's coming up. But these are the general recommendations. High vitamin C helps to absorb iron. Foods that are rich in vitamin C include orange and cantaloupe and tomatoes. Make sure that you're getting enough calcium. Again, this is one of those topics that it's questionable. I would encourage you to go out and do your own research as to what is the best source of calcium, whether supplemental calcium is the right choice for you, the right option for you. But in any event, if you look and take the big idea out of this, notice that everything here is basically a whole food item, right? There's a saying, food doesn't have ingredients, food is the ingredients. So when you're looking at your dietary intake, the best advice out there is look for as much whole food as you can bring in, as much fresh food as you can bring in, and then talk to the healthcare provider that you trust, talk to the people that you know, that know you. There are so many different conditions out there that are negatively impacting the GI tract, negatively impacting digestion, from irritable bowel to Crohn's to I already said IBS, to gluten sensitivities and other things. You should have a customized recommendation specific to your situation. So take that advice, but generally speaking, the overall emphasis is increase the quality of your whole food diet to best prepare your body for the challenges that lie ahead. And so eating light meals, especially during the day before surgery, the combined effects of anesthesia and your medication may slow down your bowel function. If you have done any research on clinical fasting, therapeutic fasting, I would encourage you to get out there and do it. Certainly there are some opportunities there that I think should be explored, but it's impossible for anyone to give you advice absent of your physician, because nobody else knows what kind of medications you're on, what kind of other complicating factors or influencing factors are out there for you. So please be mindful that you have to talk to your doctor. But I'm going to be the first one to say that sleep and nutrition are probably the greatest contributing factors to a positive outcome. Exercise is running a close second, and then finding your support system would be third in this overall idea. So let's wrap up here. We talked about all the great things to do. In the next segment, I'll share some some exercise recommendations on videos that how you can specifically strengthen the hip, the ankle, the rest of the body without aggravating the knee joint. But let's talk about some don'ts, right? Across the board, everyone's going to recommend you stop smoking. Smoking is going to negatively impact your ability to heal. It's going to drive up negative markers in your blood and in your body that are going to make what's already a challenging event that much more challenging. Certainly alcohol consumption is another one that needs to be assessed, and reduced or eliminated if at all possible. Dietary guidelines, blood glucose management, that's what I was referring to back in the dietary section. Talk to your doctor about managing your blood sugars. I can tell you right now, the stress of surgery, the sleepless nights, the pain, all of those things will raise your blood sugar. Even if you're a non-diabetic, your body's physiologic response to pain and interrupted sleep and stress all trigger an increase in circulating glucose levels. So if you are diabetic, it's that much more important that you closely monitor your particular response. Certainly the medications can increase blood sugar levels and make it challenging to keep those levels where they need to be. Medication. This has to be managed by your surgical team and your primary care physician. Some medications thin your blood, increase the risk of bleeding after surgery, or interfere with healing. These medications may need to be stopped before surgery. If you take medications that contain aspirin, anti-inflammatories, blood thinners, warfarin, or arthritis medications, which most of my patients do take these medications, ask your surgeon when to stop taking these medications. So lots of stuff for you to consider. If you haven't started making a list of questions, let's start right now. This is top priority on your list of questions. Make a list of your medications, take digital photos if you're not sure what you're taking, and talk to your surgical team to know what you can stop, when you need to stop it, and for how long. Okay, guys, I'm going to end this module right here. In the next section, we're going to talk about home safety preparation and some recommendations that you want to start addressing now before your surgical procedure. Guys, I'll catch you in the next video.